You suffer from tingling in your hands or feet, or perhaps you experience sharp burning pain running up your leg. Here to share how they can treat the aches and pains of peripheral neuropathy, we welcome back from Multnomah Medical Clinic, President Brent Jaffe. Good to see you again, Brent.
Nice seeing you.
What is it exactly?
Neuropathy?
Yeah.
So there's our nerves are constantly sending signals to our brains.
Right.
And so for a number of reasons, the nerves, the sheath on the outside could become compromised. And when that happens, the brain has a hard time receiving the messages that they used to send. So when your toes start tingling and they're getting numb, those are usually the first signs of neuropathy, because those are the nerves that are furthest away from your brain.
That was leading me to the next question, which is symptoms of neuropathy, and it starts with tingling in the toes. Anything else?
It could start with numbness.
Could just start with numbness. Okay.
Not everybody, but there's a few different symptoms. The most common are numbness, where people have a hard time feeling the floor,
Oh,
like
gosh.
it feels like they're walking on pillows.
Oh, that'd be awful.
Yes, and then which can cause problems because people can step on a rock or a piece of glass and get an infection and not know it.
Right.
Then there's the tingling, and also burning and stabbing pains.
Wow.
So they can become quite severe. So when they start off and they don't seem so severe, like it's just a little numbness, I think patients or people, right, we're all people, just wait on it because it's not so debilitating.
What causes this?
There's a number of different causes. Most commonly, people talk about diabetic neuropathy.
Right.
The blood sugar causes a restriction that causes the myelin to be compromised. Chemical reasons like chemotherapy.
Oh, yeah, that makes sense. Yeah.
Other medications can cause it. Vitamin deficiency can cause it. But really, one of the most common causes is called idiopathic, where nobody knows what caused it.
Right.
And that's up to 46% of Americans could have idiopathic neuropathy.
What are some medical solutions and treatments?
There's basically four most popular solutions. The number one is what patients are most familiar with, gabapentin, which is a nerve drug.
Oh, yeah.
The number two is Shockwave now. It wasn't like that 5 years ago. It's moving up. Shockwave's the only one that mentions actual nerve repair. So we're actually repairing nerves with the shockwaves, while gabapentin is just a nerve blocker. A TENS unit gives you temporary relief, and surgery is a last-ditch effort. That's got to be something severe. And notice stem cell injections aren't even on the list of suggestions.
Yeah, and you offer shockwave therapy.
That's what we do in our clinic.
That's what you do. Okay,
seventh year.
Is it seventh year? Is it painful?
No, it's not painful. Well, it depends on the patient. So everybody's going to react to things differently. Well, the waves feel differently depending on how they're coming out of the device. So we use three different types. One will feel like a vibrating massage, or that one's the nicest one. That's because the waves spread out the furthest.
Right.
So they just vibrate. There's one that feels thumping, and we want you to feel that. You're helping us treat you by telling us when you're between a 4 and a 6 of intensity, you can feel that thumping. And then there's those waves spread out just a little less wide. And then there's a beam that comes out like a laser pointer.
Yeah.
That's a deeper pulse, but still tolerable. Some patients don't feel it at all. Some patients are more sensitive, but by the time they get through the 6 treatments.
And does it usually take 6 treatments, or do you need often to add more?
Sometimes we do. The standardized protocol internationally is 6 treatments done over the course of 6 weeks, best case scenario. That has an 82% success rate. In our clinic, we'll ask you to go through that protocol, then give us a call in a couple of months. If it's not totally gone or gone to the point where you're satisfied, we're going to have you come back in, and sometimes a few extra treatments kick that in, but we don't charge for those. But
okay, and you have an offer for our viewers, right? Tell me about that.
Yeah.
15% off?
15% off. We don't usually do offers, but it's January, it's the beginning of the year, there's a lot of stuff going on. People want to start getting healthy again. So for anybody that calls us and comes in and starts their new protocol, total of 15% off. the entire protocol for the month of January. Thank you for mentioning
Yeah,
it.
that's so great. All right, we're going to put all that information for you on our website about Multnomah Medical at 503-766-4338. All you have to do is go to k2.com/AMNW. Brent, thank you very much. Good to see you again.
Thank you.